Good afternoon, everyone. Welcome to Fil-Am in Focus, a program by the Asian Community Development Council, or ACDC, wherein we discuss issues, successes, challenges, and opportunities affecting Filipino Americans. I am your host, Edelvi Solano. In our last episode, we celebrated August as buwan ng wikang pambansa, or National Language Month, to promote traditional Filipino language and culture. But did you know August is also National Immunization Awareness Month? This is an annual observance to highlight the importance of vaccination for people of all ages. Joining us today on Fil-Am in Focus is Dr. Flora Saison. She is the president of the Philippine Nurses Association of Nevada and a nurse educator. Receiving her Doctor of Nursing Practice degree from the University of Nevada, Reno, Dr. Flora Saison's educational journey has been a testament to her dedication and passion for nursing education. She is currently a tenured professor of nursing at the College of Southern Nevada and an adjunct faculty member of Roseman University. So Dr. Flora, welcome to Fil-Am in Focus.
Thank you, Vice, and good afternoon, everyone. Magandang hapon po. Thank you for having me.
Oh, I'm so excited po to speaking with you. And before we start, I would just like to have you, talk about your career path and how you started po.
Yes, so from the Philippines, I'm already a nurse educator. I started as a clinical instructor, and fortunately, I was able to get a scholarship. So I was able to come here in the U.S. I started in New York, in Long Island University, where I achieved my master's degree. And then from there on, I was able to get an opportunity also here at Las Vegas. And so I'm now at another facility and a institution where I am continuing my advocacy to the young generation. We want to ensure that we need nurses to join us to become a professional nurse so we can be helping the community.
Ay, maraming salamat po for
Opo.
sharing that. And then summer is just around the corner, and undoubtedly flu season also is not far behind. So why do you think po is talking about and celebrating National Immunization Awareness Month is important?
It's very important that we have National Immunization Awareness Month, especially this August, because this is the time that we open a new semester, especially for adult educations, for those going to college, to universities, and school children as well. So it's important to keep them aware that we need to be protected. We need ourselves to be protected, and we need to protect others too. So immunization, especially those annual vaccines, like for example flu vaccine, this flu season, so starting September, we need to have flu vaccine, and COVID-19 as well. If there's the new strain for the COVID-19, so we need to ensure that we get those vaccinated also.
And especially school just started with pre-K to about age of 12, if I'm not mistaken, nung, August 12, and then for the college students, August 20. So which is today yung start. So it's very important. Like what you said po is to protect yourself and others po from illnesses.
Yes.
And then
correct.
people also, I believe it's important to understand the risk of not getting vaccinated.
Exactly. Yeah.
And then yung importante rin po ba yung, kasi especially protecting other people, especially dun yung may mga health conditions.
right? So chronic conditions, like for example, our elderly population, they have chronic conditions like diabetes, hypertension, heart diseases. So they are the ones that are really vulnerable and they need to be vaccinated.
I see. Ano po ba yung mga vaccines that adults should be aware of?
So first and foremost, we have the flu vaccine, and also for the elder population, they should have the pneumo vaccine, and for the pregnant women, we encourage them to do the tetanus toxoid. So in our school, we have required immunization. So as nurses, we need to be vaccinated so we will be able to protect our patients. So we encourage them to do chicken pox, and then we have the so I mentioned about the COVID-19, I mentioned about the flu vac, and then the Hep V, hepatitis B, the HPV, and MMR. So Tdap also is another vaccine. So these are the different vaccinations that we need for adult population.
Especially po yung for winter po, which everybody should receive, yung flu, and then COVID-19 to prevent yung COVID-19 or yung severe illness po. And then, like what you said po, yung HPV po, recommended yun for people 26 or younger?
Younger.
And younger, and then adults na 27 to 45.
That's correct.
Okay. And then Tdap po, ano
The
po
tetanus,
yung... Okay.
diphtheria, and pertussis.
I see.
So this is also part of the annual vaccination, and we actually give 2 doses of that, and it will be according to CDC, we need to give those to pregnant women every 10 years. So that's where we need to have the Tdap vaccination.
I see. And then po yung recommended naman po ang meningitis for people who are living in mostly mga shared housing. Tama
Right.
po ba?
In the dormitories, we have college students living in the dormitories, so they need to be vaccinated as well.
I see. And then aside from that, yung mga vaccines recommended for adults are yung hepatitis B as well as shingles.
Shingles,
Opo.
yes.
And then these can be obtained in in pharmacies and
Yes, they are available in the pharmacy, and we have also our Southern Nevada Health District, so they can also give those immunization vaccines. And we have, I know ACDC is also collaborating with a pharmacy, right?
That's
So,
right
yeah.
po. So we also collaborate with SNHD in having pop-up vaccine clinics around down po. And then thank you for mentioning that. And then also as a nurse educator po, how do you approach teaching the importance of vaccines?
Vaccines, as I've mentioned, is part of nursing profession. So we encourage, and it's actually we mandate that a new student nurse should have all these vaccines, because we are taking care of patients. So not just like in the school, but especially in the facilities, the healthcare facilities, we have vulnerable patients. So it's protecting them and protecting themselves as well to get those diseases.
So you're instilling po a responsibility to the students of their own health as well as the health of others.
Right. It is being accountable of your being help to the others, to your clients and patients. So you become responsible.
Accountable, and being a responsible health educator and health practitioner.
Right.
Opo.
Yes.
So it's more on talagang promoting public health in our community.
Exactly. So awareness, it means that we protect. We increase also protection to our population. Yes.
Ano po, yung World Health Organization has identified that vaccine hesitancy has a lot to do with misinformation. With your practice po, what are some of the misinformation that you have encountered?
Right. So we have populations that are having different beliefs, different cultures that not are educated about the importance of vaccines. So some of them are hesitant, and some of them are really not having this education to have a vaccine because they think that it is not doing them good. So in our end, as educators and nurses as well, healthcare practitioners should encourage them to have a trust and be educated on the effects of vaccines, because this is for their protection. We must give educational awareness so that they will be thinking that this is for good. It's not just, it's not just a regulation or requirement that they should have this, but it is for their good. So some will not really, be aware, or they don't want to have the vaccine because of their belief. Yes.
I see. And then, so it's more a lot to do with education. So
True.
that's how you respond to the misinformation, is by getting people educated about
Campaigning.
Campaigning.
Yes, campaigning for awareness that this is a protection, and this will help them in the long run.
And then through those campaigns, you also promote the benefits of the vaccination.
Of course, yes. So benefits, most especially for children when they are growing up, they will be prevented having to incur these diseases or illness that will like disable them, or will make them sick in the future. So we want to ensure that we monitor and we track the immunization, so that when they grow up and when they are already grow older, they are protected as well. So they are educated with the importance of vaccines.
And do you believe po that part of addressing those misinformation and also is actually making the vaccines convenient for our community?
Right. So making it convenient, like what ACDC is doing, that you have a pop-up clinic and other facilities, or the pharmacy and the Southern Nevada Healthcare District, when they have this available for the population, then it's easy for the for people to get vaccinated. So they have educational materials, they have pamphlets to explain, and it's available for them in a convenient location.
Yes.
So it's easy for them to get vaccinated.
Tama po yun. And then having those materials in language, kasi it's very hard to understand, lalo na po yung mga medical terms para sa ating mga komunidad, and having it in those languages help out.
Yeah, tama. So we need to explain to them in a language that they understand.
Tama po yan. And then, I'm interested po, what gravitated you towards, focusing or advocating for immunization, po, sa career nyo?
Yes, so as I mentioned, this is inherent in us as professional nurses. We actually campaign for protection. So I have to live by it and advocate for immunization and vaccination, especially for our incoming students. And when they become professional nurses, I always like encourage them to get vaccinated as well, because as we know that this is for protection.
And it
Yes.
starts with yourself.
Exactly. Yeah. So if I am vaccinated and I show them why it is important to me and the benefits of vaccination, then they will see that, hey, yes, they will realize that it really helps and it protects them from these diseases and illnesses in the future.
Right.
Yes.
Thank you po. And in your view po, what can be done at the community level to improve immunization rates po?
This is again in connection with those availabilities, right? Being convenient for our population, for our community, putting up your pop-up vaccine clinic, and having also Happy Medical Center, right? So having all these facilities to our kababayans, then it's easy for them to really go out and get vaccinated. And even like for example those home-based, we have home health that can give them the vaccination. And also in the hospital we encourage them to before they are discharged, we tell them that, hey, this vaccine is available for you. So for example, we have a like an elderly patient, then before they go home, they can be vaccinated with the pneumo vaccine. So it will protect them for getting pneumonia. So the flu vaccine too. So when it becomes live this September, then we can really give them the flu vaccine. Yes.
Ang worry din po kasi is yung vaccines are expensive. And then, so usually some are uninsured and then or even underinsured. So I think that's some of the barriers that yung ating community is facing. So,
Yes. Yeah. So sometimes they have the notion that, hey, we don't have health insurance. How can we get this vaccine? So with all these community resources that we have, like what ACDC is doing, and we are really proud that we are, we have ACDC in our community because you are always giving resources to them. So they will be encouraged to go out and have the vaccine because they know that they have help. So they have resources in the community.
Likewise po, Philippine Nurses Association of Nevada does a lot of work for the community. Ano po yung mga programa na ginagawa po ng organization niyo po?
Yes, thank you for mentioning that. So the Philippine Nurses Association of Nevada is always for unifying the nurses and helping out nurses here in our community to do their work. So we conduct educational seminars, we have also community outreach, and just bringing education to the public to give them awareness that we have this like different topics every twice a year. We do it like fall, and then we have also the spring seminars. So we also help out and we collaborate with other community organizations to disseminate this information and bring them the resources as well.
Yes, oo nga
Yeah.
po. And speaking of Philippine Nurses Association of Nevada, you have all been amazing drivers of vaccine equity through the years.
Thank you.
With ACDC po, we have collaborated a lot with getting everyone vaccinated in our community. So maraming salamat po with that collaboration and educating, providing education, not just resources but also conferences for our kababayans and
Opo,
the
yeah.
whole community. Meron yung dalating po na fall. Ano po yung event na mangyayari po
Yes,
this
so
October?
this time we have an exciting topic because it's about cultural fluency. So this is also talking about barriers. Then we need to build trust. So the title, if I may read it, Cultural Fluency, Overcoming Barriers, Building Trust, and Improving Outcomes. So we know that we all have this community resources and we want to see an outcome. So at the end, we are also, the goal is to have, even if there's diverse cultures, we will have one heartbeat.
Oh, wow.
Yes.
Ganda po nung ng event nyo. Invite po natin ulit yung ating mga nakikinig po ngayon sa October 19.
Yes po. So I invite everyone. This is just not for the nurses, but everyone in the community. If you can come on October 19, this will be in Optum, North Tenaya, and we are going to have really very relevant speakers to talk about cultural fluency. So come and join us on October 19.
Okay, maraming salamat po. And again po, as a president of Philippine Nurses Association of Nevada, what inspired you to take on that role?
Oh, I know. It is really a very big role, and it comes along with responsibility and challenges. But I have grown to become more, I would say, I learned a lot from walking this role or working with the organization, because apparently it's not me, but it's the community that we serve that always benefit from our services. So this has been a really a meaningful role for me. So thank you very much for all the collaboration that we have been doing, and I also say shout out and kudos to all the organizations that have been very supportive of the Philippine Nurses Association, because if not for them also we will not be here. So as we envision that there will be unity in our community, all the organizations will be working together. Yes.
Thank you po. And then, ano pa po yung goal nyo para sa organization, aside from collaborating with more CBOs?
Yes, so I envision it to grow with the membership and all the programs that we can give out to the community. So right now we have the mentorship, and we also have, as I mentioned, about the educational seminars earlier, and we promote self-care. So all our advisors, our members are doing great work for the community. So we help our nurses, have some relaxation through the self-care program that the PNA is doing right now. And also we have the FAPCOR. So we collaborated with another organization also. This is the Filipino-American FAPCOR outcomes. So
with Dr. Elizabeth
Elizabeth Delian Gaboa is spearheading this program, and she is really working hard to help out our community to promote healthy living. So kasama yan sa mga programs ng Philippine Nurses Association right now. So there are so many things that we can still do, and the community is there, and we will continue serving them.
Okay.
Yes.
Maraming salamat po sa mga programa na mga ginagawa nyo. At ito po ay free para sa mga nurses po, na yung programa po na yun, yung self-care.
Yes,
Okay.
yes. So we have those, and also we have the mentorship. Those new to our community, nurses coming from different states, or they just came here from the Philippines, we are available for them for mentorship so they can navigate the healthcare industry here in Nevada, and it comes along with the self-care as well. So they are taught how to, separate themselves from the professional life and at least have time also for their personal life. So they will be more, I would say, beneficial, and they can help more other people in their profession.
Opo. Talagang it starts with yourself po.
Right.
No? Talaga. Tapos para you are able to give more of yourself to others. Well, thank you po
Yes.
for that. I know, Dr. Flora, we are coming to an end of this podcast. Ano po yung advice nyo para sa ating mga kababayan?
It's immunization month. So National Immunization Month is here. Please go out and be vaccinated, especially po flu vaccine. We don't want you to get sick during the winter time, and the cold season is here. And also there's a new strain for the COVID-19. It's again everywhere, so please do protect yourself and protect others too. So thank you very much.
Oh, thank you. Thank you po. So get vaccinated, mga kababayan, and I'd like to invite everyone for who are listening and watching to visit the Philippine Nurses Association of Nevada on their website pnanv.org para sa kanilang mga programa about self-care and mga educational resources po. So Dr. Flora, maraming salamat po for your passion and commitment in protecting families from illnesses and making sure that we get educated po about getting vaccinated. Opo, at saka mga programa, lalo na sa mga healthcare providers po natin.
Yeah.
Maraming salamat po sa inyong work at suporta sa atin.
And maraming salamat din po for having me. Yes.
Thank you po. You are truly a health champion po. Thank you po. And then, sa mga, maraming salamat po ulit for joining us. Be sure to visit ACDC at acdcnv.org and follow us on our social media channels. Abangan po ang aming susunod na episode hanggat sa muli. Maraming salamat.